Rise again. Hey guys, I have Brittany Trevino here. She is one of our patients and she is going to be our tribute to teach y'all all how to do the microneedling. So we are going to be using the MD pen for our microneedling procedure. It is an amazing pen. It has a lot of great features. Whenever you get the pen, it will come in this stainless steel box. This is what the actual pen looks like. The needles, which will come in there, they are in these little packages. They are sterile, so make sure that you handle them with care and then obviously dispose of them appropriately as well. Whenever you get the pen, you can go ahead and attach the needle. So it just kind of pops in like this and you will hear it click and then you'll twist. On the side, this is the on-off button, so you'll see that right there. It does have 3 settings, fast, medium, and slow. The faster you go, the less painful it is for your patient, so just kind of be cognizant of that. Now, all of the medicine will also come to you and that will be shipped from Stephanie. So you will already have, it will be 1 cc of the Sculptra, it will be the 0.4 of the Versa, you also have the vitamin B12, the vitamin C, and the toxin. All of that will come in separate syringes for you, so all you will have to do is combine them together. So don't worry about any type of calculation or anything like that. I'm gonna go ahead and draw this up. They are gonna come in pre-filled syringes. It will have a little stamper at the end as well. So all you will have to do is combine them into your syringe and then you will put that solution on the patient's face and that will help you glide over the patient and that will help get that medicine in that patient's face whenever you are doing the microneedling. So I'm gonna finish kind of drawing everything up and putting it in. I've already done the Sculptra and the B12, and then so I'm going to be adding the other ingredients as well. So let me do the filler. So it comes in like this, and all you're going to have to do is you just squirt it in there. The toxin does need to be put in there at the very, very end. Almost done. And perfect. And then you will also do the toxin. It goes at the very last thing, and that just kind of helps protect the toxin from all the other things that are in there. So you can see because of the B12, it gives us this beautiful kind of pink color. Once you have everything in there, you can kind of turn it up and down, and that will kind of mix everything. Okay, you don't want to be shaking this vigorously or anything like that. You can roll it, just don't shake it back and forth, okay? So just kind of back and forth, and that will kind of get everything all integrated. And then whenever you go to squirt it on the patient's face, it will also kind of help mix it as well. So I have already pre-numbed Brittany. The kit will also come with your numbing cream. Please make sure that you put this on the patient and you let it sit for a good 10 to 15 minutes or so. That will help ease any of the discomfort that's associated with the actual procedure. Once you have cleaned the patient's face and you've numbed them, clean the patient's face one final time, and then you can go ahead and start the procedure. Now, when you start, it's best to start on the forehead because that does tend to be the most tender. Whenever I microneedle, I usually start at 0.5 and kind of work up in 0.5 increments. I try not to go above 1 on the patient's forehead just because that frontalis is so incredibly thin, it can be pretty uncomfortable. When you do get to the thicker portions or the part of the tissue that can handle a little bit deeper penetration, you can go all the way up to 2. I don't recommend hitting 2 on a naive patient, so really start at that 0.5. And since Brittany has had this done one time before, I will probably end right at 2 on her cheeks. If she can tolerate a little bit more, I might concentrate some areas at that 2.5, but really listen to your patient. If they're at all uncomfortable, go ahead and dial back down. You want to make sure this is as comfortable as possible for them. So we're going to go ahead and get started. I'm going to start on the forehead at 0.5 and kind of do 0.5. I might hit 1.0 right around the crow's feet, and then I'm going to bump it up to 2 all on her cheeks, going down to the mentalis, and then right when I get over to the lips, I'm probably going to dial that back down to 0.5 and try to see if I can get it up to 1 for the patient. She's one of my good friends, so she will let me know if it hurts. I'm pretty sure she'll be like, hey, girlfriend, stop. So we're gonna get started. This is a really easy procedure to do. It's not difficult at all, and it gives your patient this beautiful glow. As far as aftercare, we want to tell all of our patients to not put any makeup on for 24 hours afterwards, okay? And then really kind of take it easy over the next day. We don't want them going and doing any type of marathons or anything where they're going to be sweating a lot. when you take your certification class, what you're going to see is there's a lot of information of pre and post instructions that you need to let the patient know, and there's some really great visuals in there as well, showing the types of penetration and how that tissue heals. So you can see immediately after you've opened up a lot of channels in the patient's face, and so you want to make sure that they're not putting makeup on, they're not sweating a lot, because you don't want to expose that patient to any type of potential infection going on. So, okay, Brittany, come scoot closer, just a little bit closer to me. We're going to cleanse your face one final time. And obviously make sure the patient is not pregnant or breastfeeding. Follow all normal MFL protocols. But it's a pretty simple procedure. And the first time she had it, she had some really, really great results. I saw her a few days afterwards. I was like, oh my gosh, her skin looks so good. Gives you a nice glow. And you will see that's why this procedure in a lot of offices is called the glow. Sorry. So again, just make sure everything is nice and mixed. You can see. Okay, and chin up. So I'm going to make sure I started at 0.5, and it's pretty easy to dial. And you just kind of hold it down, and then it will start. Red is the fastest, and as you start to go, it will do the different levels. So there we go. So I'm going to start right on the patient's forehead. Rub it all in. Just kind of gives you a nice little surface to kind of glide. So I'm going to start right at that hairline and just kind of glide over her. And I do 3 passes, okay? So you can do straight lines. Some people like to do cross hatching, and then some people will do circles. You'll find whenever you are doing your certification, they're going to tell you a few different ways to do it. I actually like to do the cross hatching because I think it's a little bit more comfortable for the patient versus the circles. You are going to get pinpoint bleeding. That is normal and expected. The patient's going to feel like a light kind of tugging, little tugging sensation. They're not going to feel anything super sharp. It more feels like sandpaper kind of going across the patient's face. Oh, there we go. So I just did 2 passes. Now I'm going to do my final one right on her forehead. Brittany, how are you doing on pain? Good. And she's already kind of turning that beautiful little pink color and kind of get really in between that glabella. There we go. So now her forehead is done. I'm going to have you go ahead and sit up for me. So you can see she has a little bit red. She's starting to kind of get that pinpoint bleeding already, which is absolutely perfect. So that's why it's really important that she doesn't put any makeup on or go sweat, because those channels are going to be open for a good 24 hours. Okay, go ahead and lay back down for me. Now I'm going to move on to her crow's feet. Again, constantly making sure that everything is nice and integrated. If anyone does have any type of blemishes or anything, make sure you do not go directly over them. So now I'm at her crow's feet, and I'm going to try to bump it up just a little bit more for her crow's feet. Instead of going to 1, I'm going to go to 0.75. Brittany, if it's uncomfortable, let me know, okay? You doing okay?
Yeah.
Okay, perfect. You want to make sure you're right on that orbital rim on the outside, so be lateral of that, of the lateral canthus of the eye, okay? Again, kind of cross-hatching. And getting nice little pinpoint bleeding as well. There we go. Perfect. Let me do the other side. I'm doing okay on pain?
Yep.
If you do feel like the pin is tugging, you need to add more of the lubricant because it's not going to slide, it's not sliding appropriately on the patient's face. Okay? So again, little pinpoint bleeding. And go ahead and sit up. Perfect. So you can see again, little pinpoint bleeding and some redness on the frontalis. So exactly what we were expecting to get. All right, so now we're gonna go down to the cheeks. I'm gonna bump it up to 2 and see how she does with 2. I'm gonna go ahead and have you turn just a little bit for me this way. Perfect. Again, putting more of that lubricant on there, and just use your glove to kind of spread it out. The patient is going to be red. It's going to be like a sunburn, okay? So I'm gonna bump it up to 2, and I'm gonna see how she's feeling. If it's too intense for her, she'll let me know. Doing okay?
Yep.
Okay. So you're gonna take a little bit more time on the cheeks, especially if the patient has any type of scarring or any type of issues or skin discolorations on there that you're trying to get rid of. You really kind of want to concentrate on those areas. How you doing on pain, Brittany?
Good.
Good. So again, kind of cross-hatching. And kind of pull the skin taut. That kind of helps slide the needles over her skin. So you want to make sure you're holding even pressure and you're going evenly across the patient. You still doing okay on pain?
Mm-hmm.
Perfect. Go ahead and sit up for me. And you can see nice little pinpoint bleeding and nice little pink starting to kind of show up. Gonna go on the other side. Okay, and again, turn your head for me. Perfect. Kind of putting it on the patient's face. You're gonna be able to see little particles of that filler on there. And that just kind of helps slide those needles across the patient's face. Doing okay in pain over here?
Yeah.
Okay. This procedure shouldn't take you more than about 10 minutes to do, okay? So pretty similar just to doing a filler patient as far as the actual procedure goes. Perfect. All right, let me go on the other side. And now I'm gonna do just a little bit on the patient's nose. I'm gonna dial it down all the way to 0.5 on the patient's nose, just because obviously that skin is very, very thin. And then when I get to her upper lip, I'm gonna try 0.5. If she can tolerate it, I'll go all the way up to 1. But again, listen to your patient. If they're saying it's hurting, stop and dial it back down. Okay, so I'm gonna go on her nose, so just a little bit. Perfect. I'm going to dial it down. Okay. And again, just ask your patient how they're feeling. Go ahead and turn towards me. You doing okay?
Mm-hmm.
Okay. So constantly talking to your patient will make sure that they are comfortable. And if they are giving you any indication that it is uncomfortable, go ahead and dial it back down. You can go all the way down to 0.25 with this device, so it's really, really nice. Okay, and then now I'm going to go to the patient's lip. Go ahead and tuck your lips in for me. Perfect. Okay, so I'm going to start at 0.5, and if she can handle it, I'll go up to 1. So I'm going to do 1 pass at 0.5. How are you doing on pain?
Mm-hmm.
Okay. Okay, so I did 1 at 0.5. I'm going to try 1. And if it's uncomfortable, she let me know. Are you done okay?
Mm-hmm.
Was that right?
Mm-hmm.
Okay. We are almost done. Perfect. And now I'm going to go down to her chin. I'm at 1 with her chin. So again, just to kind of recap, I start at 0.5 on the frontalis. Crow's feet, I'll usually do 0.5 to 1. When you go down to the cheeks and to the thicker tissue areas, you can go all the way up to 2.5. I usually do about 3 passes. You do want to get pinpoint bleeding. That is normal, and that is the goal. You don't want the patient to be saying, oh my gosh, this is really kind of hurting a lot. If it is hurting, go ahead and dial back down. You doing okay on pain?
Mm-hmm.
Wonderful. All right, perfect. All right, and I have just a little bit left. I'm going to go over her cheeks just one final time because that's one of her concern areas. So I have a little bit left. The Sculptra is going to really kind of help all of those, the acne scars and any of those skin discolorations. Okay?
Mm-hmm.
Numbing medicine is amazing. Make sure you numb your patients. Be kind. So what you're doing is you're creating all those little micro channels in there. You want to try to get that Sculptra in there, that hyaluronic acid filler. It's really going to help clean up the patient's face. Any of those skin discolorations or any of those little scars, it's really going to kind of help rebuild all of that for your patient. So they are going to love you. This is an easy procedure that you can offer all of your patients. Again, make sure they fill out all the appropriate consent, not pregnant or breastfeeding. If they do have any active lesions on their face, obviously do not microneedle over any of those lesions. You doing okay on pain still? Perfect. The patient will be red, so when they leave or whenever you leave their house, just make sure you give them good aftercare. You need to make sure that they're taking really good care of their skin. Those channels are going to be open for a good 24 hours. They can go ahead and they can clean their face the next morning. They are going to leave all of that medicine on their face for tonight. So she's going to kind of feel pretty gross, and she's going to have all of this kind of gross stuff on her face. But this will sit on her face for the rest of the night. She can wash it tomorrow morning. Sunscreen is going to be essential because not only did I kind of take off a top layer, I also got rid of a lot of the hair on her face as well. So sunscreen is going to be really important. Good skincare. You really want to make sure that they put on a great moisturizer the next day. The Alastin line has a great post-procedure serum that you can offer your patients. It really kind of helps rebuild everything and have that skin, that cell turnover a lot faster so your patient can get to the results that they want quicker. All right, guys, if you have any questions, please feel free to reach out to us. We are so excited to offer this new procedure to y'all. And if you have any questions, let us know. Bye.